Hello, and welcome to Wellness Wednesday podcast, where we have real conversations that help you restore your energy, improve your health, and live with purpose naturally. So, I'm your host, Bonnie Schnautz, and I'm a naturopathic doctor, digestive health specialist. And Wellness Wednesday is where we help bring practical wisdom into your life with honest conversations with either practitioners or leaders in the arena of natural health who are helping people get to the root cause of their health issues. So today's conversation is especially important because so many women are doing everything that they can, eating better, trying to manage stress, if that's even possible today. Yet they really don't feel like themselves. So often the missing piece is really understanding how the body works, how it was designed, how it can heal, and what may be interfering with that process. So I'm honored today to welcome my guest, Dr. Diana Herr, and she is a integrative chiropractor and practitioner of traditional Chinese medicine. She's here in Somerville, South Carolina, and she combines Eastern and Western therapies, including chiropractic care, acupuncture, cupping, herbal medicine to help patients address the root cause of pain and restore balance in the body. So, Dr. Herr, welcome. I am so glad you're here.
Hi, thank you for having me. I'm excited to be here.
Excellent. So let's just get started, and I'm gonna ask you some questions that I think just from learning more about you, what you do, and from my work as well. So what I see, of course, is that same. I see that women over 40, they're struggling. They have symptoms. They're going to the conventional, allopathic doctor, and they're being told, you're getting older, right? Things like fatigue, pain, feeling out of balance, and really that's emotionally, both emotionally and physically. So, from your perspective, share with us what are the most common complaints that you hear from women over 40?
Well, I would say being over 40 myself and having experienced some of this
Right.
myself. But the things that most people come in with, I would say, would be, poor sleep leading to fatigue, anxiety for sure, aches and pains, digestive complaints, hot flashes, night sweats, of course, when we're getting into that, that perimenopause. And then,
Mhm.
as we continue on through perimenopause, those tend to get worse. And then the biggest one, I think, is stress. And
Mhm.
stress is the thing that I think exacerbates all of the other symptoms, or if they're already there, makes them worse. I think the biggest thing with stress is that it increases our cortisol. And when our cortisol increased, at least for women, it then kind of steals that progesterone, which is the calming hormone. And when we
Mhm.
don't have enough progesterone, then the estrogen progesterone, it gets out of balance. So
Yeah.
that's when we see a lot of the symptoms of perimenopause with the anxiety, the hot flashes, the poor sleep, and that sort of thing.
Yeah, 100%. That's what I tell the three pillars. There's stress, there's I call it the chemical slash nutritional component. There's emotional, physical stress, and then but no matter what, that emotional stress will trump it all, right? I
Right.
mean, it truly does. And I love what you said about making that correlation between the cortisol is stealing, the hormones that we need to progesterone that we need to be calm. So, what symptoms do you see that improve most out of all these things you mentioned? I can so relate to these personally and professionally. What symptoms do you see that respond best with acupuncture?
I think the things that respond the best and honestly the most quickly is that feeling of just being like stuck in fight or flight, that
Mm.
anxious, can't sleep, tired but wired feeling. I think that
Mm.
we can almost, excuse me, we can almost see an immediate relief with
Wow.
that after one session. Now, it typically doesn't last very, very long after one session, but you will get that automatic sense of calm after
Yeah.
the session. We actually call it AccuStoned because you feel a little bit, I feel a little bit loopy, calm. It's
Um,
a great, it's kind of a euphoric but calming feeling, and a lot of people really, really like it.
yeah, that's very cool. Yeah, and probably why the part you mentioned doesn't last because they go right back
Right,
to doing what they
exactly.
were
To doing
doing
what they were doing. Yeah.
emotionally.
And I
Yeah.
always
So,
tell people to, after the session, let's not drink any coffee for the rest of the day because coffee is going to get us right back to where we were. Like,
mhm.
ah,
Right.
I got to get
Exactly.
this done.
Yeah. 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 And then they're going to be all, yeah,
Right.
jacked
Right.
up and impacts their cortisol.
Exactly.
Okay.
So I would say that's
So,
the biggest relief. I mean, we do see relief with all the other symptoms too. Once we can get that calm feeling, once we can get that cortisol to come down, then we do see a reduction in the hot flashes, in the long-term anxiety, in the digestive issues. And then for any stubborn complaints that, we're having a little bit more of a difficult time with, we add in some Chinese herbs, and that really, really does the trick.
yeah, absolutely. So how exactly does acupuncture work and how long, and you've talked about this a little bit about seeing results. So talk in about that in a little more in depth because I think a lot of people are terrified. If they're terrified of needles,
Right.
then like, oh, I'm not going to get acupuncture. I'm like, well, it's not exactly the same. So try to walk us through what that looks like.
Sure. The way acupuncture works for what we're talking about is there's certain points in the body that actually act directly on the autonomic nervous system. And the autonomic nervous system is the fight or flight and the rest and digest that we hear about. So we automatically use those points. We use those points pretty much, I would say, for most, things that people come in with, just to kind of get, out of their head about the needles being inserted in their body. But that automatically gives that sense of calm. And then acupuncture also works to increase blood flow and circulation to areas that, we may want to focus. Like the reproductive organs in females, we definitely do a lot of abdominal points to bring blood flow to that area. And then if they're having aches and pains, joint, back, neck, we needle those locations to bring blood flow and bring circulation and bring healing, and that sort of thing. So I would say
Okay.
those two are the biggest mechanisms that acupuncture helps with for female stuff and hormone balance.
Okay. And then how long, like if you were to give someone a time frame, what do you recommend? How many times would they have to, have that experience or that session?
And that's a great question. It depends on how out of whack they are. It depends on how long they've been experiencing the symptoms. But a good rule of thumb is about 4 to 6 initial sessions. And what I mean by that, I like to see people about once a week for a month. We hit every cycle, every phase of their cycle. So once a week for about a month. And then after that, for that second month, I like to see them, especially if their cycles are regular, this is easier to figure out. I like to see them right before ovulation and then right before their period.
Okay.
And
And
then
what,
from there, then we go and, we say, hey, do we need to continue doing once every other week? Can we go to once a month? Are we going to add some Chinese herbs in that they can take, in between the sessions?
okay. And what about menopausal or postmenopausal when they're no longer cycling? What does that look like and how does that differ? Because a lot of them, they're still going through a lot of the
Right.
hormonal issues.
Right. Yeah, exactly. And, we may see them. I usually do again about once a week for about a month, with those women too. And then depending on how they are experiencing the acupuncture, if they're getting relief, then we start spacing out the sessions to where, maybe they're coming once a month, once every 6 weeks, and that sort of thing. I mean, we also use herbs with them too
Okay,
to keep those
good.
symptoms away and to keep them in
And
balance.
okay. And a lot of women want to know like the needle, like how big is it? And I've had a lot of acupuncture and sometimes you don't even know it's going in. Sometimes, well, once it's in, you typically may not know it's
Right.
even in your skin. So talk about that, like the size. What are we talking about and how would you equate that, how it would feel?
So the needles that we use they're basically hair thin. So you can fit about 10 to 20 acupuncture needles in one opening of a hypodermic needle.
Oh,
So they're very, very thin. We use different sizes on different areas of the body. So, for example, we would use a very small gauge and a shorter needle for points maybe in the ear or the hands, the feet, maybe a bit longer for the abdomen. And then when we're dealing with musculoskeletal complaints, we do use a slightly larger gauge just because we need to get into the muscle tissue. Typically, the worst you'll feel is a pinch. and
Hmm.
sometimes not even that.
Right.
So we try to
Okay.
make it as painless as possible.
Yeah, yeah. And I don't think it is at all, but
No.
there's, yeah, everyone's different. And if
Right.
they don't know, that's typically the scary part for women.
Right.
They just don't know what that experience is like. So I like to, try to explain that as much as possible. So as far as we talked about, the hormonal imbalance, what about like strictly emotional? Like if they just know they're going through, would they be a good candidate?
Yeah, I mean, absolutely. That fight or flight and that autonomic nervous system has a big role in emotional things too. So, by calming that down, we can get women through some of the more emotional aspects of, losing their fertility or, feeling like they're getting older and that sort of thing. And I think part of the session too is a little bit of a therapy session, as women can unload and talk about their thoughts, their
Mhm.
fears and their worries and that sort of thing. And I like to put them at ease and let them know that what they're going through is perfectly normal, and
Mm.
they're experiencing symptoms. So once we can kind of bring everything down and in balance, then those symptoms will go away, and it's just a natural part of life, and we need to
Right.
embrace that.
Absolutely. And there's always comfort in knowing that.
Right.
So, what about, let's talk about side effects. And I also want to ask, of course, I know you see men, not just women, but today
For
we're
sure.
talking more about women because
Right.
that's my focal point. And then also, what about, after talking about side effects or combine that somehow, what about children and what is the age range? And do you recommend it for children, or is it kind of more of an adults only?
So to answer your questions, yes, I do see men. Children, I do see as well. Typically, if the child is under about 8 or 9, we'll do what we call seeds. So they're these little, almost they look like a little band-aid, and they have a seed on it, and you put those on, and that stimulates the acupuncture point without having to use a needle. So I will
Oh,
use that on pediatrics. Sometimes it's difficult to get kids, A, to get comfortable with the needles, and B, to sit still for the 30-minute session. So by doing the seeds, that way I mean, they can move around if they need to, without, possibly putting the needle in a little bit deeper, aggravating the needle.
yeah, yes, that makes sense. And what kind of conditions have you treated children with?
I would say the biggest one has been bedwetting.
Interesting.
Yeah, I
Okay,
would say
that's a
that's
big
probably been the biggest pediatric complaint. Most kids don't have a lot of aches or pains yet. I have seen a
no.
couple kids that were active in sports and may have had like an acute, ankle sprain and that sort of thing. But yeah, typically I would say bedwetting. And then I've actually treated a couple younger kids with autism that were having some of the outbursts. So acupuncture was able to kind of, again, calm that autonomic nervous system to get them into a more balanced place with that. I'm
Okay.
not saying we cure autism. I'm not saying that at all,
No.
but it can
Yeah,
help with
no,
some.
I get it. Yeah, just supporting. All we're doing
Right.
is supporting, yeah, the
Exactly.
body and balancing the body. That's what it's about. So, what about any side effects of acupuncture in general?
I would say the biggest side effect would be bruising at the insertion side of the needle, and not a big issue at all, perfectly normal. Does not happen with all points, does not happen at every session. That would probably be the biggest side effect. The second biggest side effect would probably be a little bit of soreness, especially if we're treating musculoskeletal complaints like a back pain or a neck pain, because the needles do go in a little bit deeper. They go into the muscle tissue.
Mm.
So sometimes we do have a little bit of soreness for about 24 to 48 hours after. The other one that was probably the most irritating, I would say, for people that are having issues with sleep.
Mm.
Sometimes that first session, a lot of people will feel great and sleep through the night that night, but some people have this rebound insomnia for one night after the session. And that can be a little, worrying and concerning to them. But that lasts about one session, and they typically don't ever experience that again. Yeah.
Okay. What
Yeah.
about feeling lightheaded? Is that just from lying down and getting up, or is that a
Time.
common?
No, I think the lightheadedness typically occurs when we have a treatment where we're treating points on the back. So they're face down for that, 30 to 35 minutes with the needles in, and then, good 5 minutes or so while I'm putting the needles in. So they're laying down for about 40 minutes or so face
Mm.
down. So some people will definitely experience a little bit of lightheadedness after that, but typically not after a session where they're face up. So I do think it's more positional.
Got it.
And
Okay.
then
Makes
and then that
sense.
AccuStone feeling that I talked about where you feel a little bit loopy. I mean, I guess you can
Mm.
consider that a side effect, but it's a pleasant side effect.
Yeah. Yes. We all want to feel a little loopy without the
Yes.
alcohol side effects or
Right.
the other
Exactly.
recreational things. Um, and then you also incorporate light, different colored lights, correct? Like red
I do
light or
I do infrared
oh, okay.
lamp over, the area of the body that we're treating, again, just to bring more blood flow and decrease any inflammation.
Okay.
I haven't
Perfect.
really worked with red light therapy yet, but I do actually plan on incorporating that with some of the cosmetic acupuncture that I do.
Oh, cosmetic acupuncture. Oh,
Uh,
that may be a whole nother.
yeah, I was gonna say there's a part two.
Yes, part two coming up for sure. All right. So, Dr. Herr, thank you so much for this information. I know it's going to help so many women really understand, it's another modality, it's another tool in their toolbox when they're looking for natural solutions. We're very blessed that you're located right here in Somerville, South Carolina. So tell us a little bit more about that. How can women or men, or maybe even youth, find you and get support in acupuncture, Chinese medicine, or even chiropractic?
Absolutely. Yeah. My practice is in downtown Somerville, right by Doty Park on Laurel Street. I'm located in Corey Chiropractic and Acupuncture. Dr. Stephen Corey is my partner. He does a lot of the chiropractic. I do more of the acupuncture and then the chiropractic as well. And if you'd like to give us a call, can I leave my number on here?
Yeah, go ahead. And we'll put all the your
Okay.
link. If you have
Perfect.
the website link, you can share that too.
Yes. Yeah. The phone number here is 843-647-0509. So I'd love to see you guys in here.
Okay,
Thank
excellent. All right. Well, Dr. Herr, thank you again so much for your time and your wisdom in acupuncture and Chinese medicine. Again, I know this is going to be a blessing and support no matter where people are in the
you.
US that they can learn a little bit more. All right.
Thank you,
Have
Bonnie.
a great day and thank you everyone for watching this very special edition of Wellness Wednesday.